Um, okay, so um, our group topic was legislation in crimes, corrections, and public safety. And so we researched bills and passed bills that regarded this topic, and each group member contributed to this report by picking a bill that they found interesting and researched it.
Okay, so this is House Bill 1063, which is the one I did. It simply expands the meaning of the term underlying crime, which is used numerous times in Title 9, Subtitle 8 of the criminal law article, which contains several prohibitions on engaging in activities that are part of criminal organization. So House Bill 1063 explains that the underlying crime for the purposes of establishing a pattern of criminal activity is applicable to the related criminal prohibitions such as the use of a firearm in the commission of a crime, bribery under Title 9, Subtitle 2 of the criminal law article, false statements under Title 9, Subtitle 5 of the criminal law article, impersonating a police officer, threat of a mass violence, removal or falsification of a vehicle identification number, and abuse or neglect of a vulnerable adult. House Bill 814 was done by Daniel Hung. Uh, so it says it recently passed House Bill 814 lists further requirements for juvenile courts and law enforcement. So here's the overview for it. It expands juvenile court jurisdiction to include children of at least 10 years of age who committed a crime involving weapons, firearms, animals, and third-degree sexual offenses. The Department of Juvenile Services officers may make an inquiry in 15 days, reduced from the original 25. It allows courts to order detention before a hearing if the crime would have resulted in 2 years of imprisonment if committed by an adult. Children under the age of 18 accused of first-time violation are prohibited from being entered into detention, and it increases time limits on juvenile probation.
So my bill was Senate Bill 950, and this bill basically does three important things. First, it allows for hospitals that do not have the facilities or staff to perform forensic examinations to receive guidance by a professional forensic health examiner during a sexual assault forensic examination. And then secondly, it guarantees survivors don't have to pay for their sexual assault forensic exam and receive reimbursement. And then lastly, it calls for a feasibility study so that hopefully the use of telehealth forensic exams can expand in the future. And in summary, this bill broadens access for sexual assault survivors to get the help that they need to find evidence to be used in court. And this bill was passed. Oh, this bill was passed in both houses and signed by the governor on March 15th, 2024. And to be a little more specific, telehealth in this bill is defined as any use of interactive audio, video, or other telecommunications or electronic technology by a forensic nurse examiner. And that was taken directly off of the Maryland General Assembly bill website. And some benefits of this bill are that first, the forensic examinations help corroborate survivor cases and collect evidence while maintaining the chain of custody that's enforced by courts. And expanding the accessibility for forensic examinations in Maryland will greatly increase the success rate of sexual assault cases in Maryland. It also ensures that every hospital in Maryland can perform sexual assault forensic examinations so that hospitals don't have to turn down survivors and send them to different hospitals that could be miles and miles away. And also, it is a solution to the shortage of forensic nurses in the state of Maryland. And lastly, it allows for anyone to receive an examination regardless of economic status. So Veronica's bill was Senate Bill 1056, and this bill adds restrictions to vendors who sell electronic cigarettes, vapes, and other tobacco-related material. It prohibits tobacco products from being in public display and requires them to be behind counters. and the consumer has to be over the age of 21 and has to check their identity with the vendor through government ID. And the Maryland Department of Health is required to check each licensed retailer at least once a year without the vendor's notice. Vendors selling the vapes are required to only sell the tobacco related material. And if the vendor sold tobacco to underage minors, the penalty could result in the vendor's license to sell cigarettes to get taken away. And the benefits of this bill are that it ensures that underage students aren't easily able to get access to tobacco. Vendors get more of a restriction to their business to ensure that they aren't abusing their power to sell drugs. The bill adds more penalties to the vendor and the buyer. Legal cigarettes become more hard to obtain, which can improve the health and mental well-being to many people, and the distribution of such drugs is more monitored. And that's it.